Welcome back to the BEAM&Flow podcast. This is a nitty-gritty exploration of your body, energy, awareness, movement, and flow. I'm your host, Chloe Cofresi. I'm a proudly Latina curandera, or a healer and a coach, guiding spirit-led rebels to their richest lives. Ready to connect? Lista? Let's go! We are here with Aleena Kanner. I'm saying that right? Yeah? Okay. So you are the first person I ever heard talk about PRI.
Oh, wow.
And we've had Neil Hallinan on the podcast before, and I found him after listening to your podcast on Conscious Wealth with Jay Griff. That's how I connected. And so
shout out to Jay Griff.
Shout out to Jay Griff. So after listening to that episode, I was like, oh, this fits so well into the work that I apprenticed in to get into what I am now. And I was like, oh, I was in a lot of pain. And I see chiropractors that are BGI, biogeometric integration.
Okay.
So they're very in line with PRI stuff, but there was still something else going on. And I looked up PRI practitioners near me, and Neil was the only one in New Jersey. And I was like, you know what? I just don't feel like dealing with traffic in the city.
Yeah.
So I'm going to go see Neil. And he's been amazing.
Wow.
But I really wanted to have this conversation with you because it's because of you that I'm
That's
even
so cool.
into this world.
Oh my God. That's so cool.
So how did you get involved with PRI?
So, long story short, I was a gymnast and an Olympic weightlifter, and I always knew, in college when I was trying to figure out what I wanted to do, I always wanted to work with sports medicine. I just didn't know exactly what, and ended up becoming a certified athletic trainer, went to University of Arkansas, and then after my time there as a student, I started to realize that what we did for the athletes was very Band-Aid approach, very treat the symptoms, get them back out. And I understand when you're in this high level sport, but I also really wanted to figure out how do we help them long term. And so when I was done with school, I heard about PRI. There is actually a good amount of people doing postural restoration in the city. They just do it to more of a strength and conditioning level instead of taking it to the dental, the vision, the integrative level. And after I took one course, and I basically was it was with Ron, who's the founder of PRI, and I was completely mind blown, but also exhausted, and I was like, this is way too much for me, and I was young, and so I slept on the information for a year. And then a year later, I had heard about Neil at that point. I probably saw him on YouTube or something like that. I met up with him. In the end, we're friends. I talk to him all the time. But I took a course a year later, and then that second course I took really changed how I understood things. So I just heard about it through the grapevine. And I also think that there's something about me that is on a chase to always figure out the best out there. I'm not going to just settle with information. So for me, it just makes sense that I'm doing postural restoration. It's a very root cause approach. It's not treat the symptom. And especially how I'm trying to do it, I'm really trying to establish this integrative approach. And that's really about looking at the whole body of somebody. So that's how I found out about it. And I think that understanding my background as a gymnast and Olympic weightlifter into sports, that also has been really helpful, just because it helps so many athletes, but also it shows you what humans can do and what you can do even better when you understand the mechanics of the body. So, yeah.
I'd love to actually dive into that a little bit more,
Sure.
right? So let's talk about people who are athletes, and they believe that they're treating their body with the utmost care and conditioning, right? How do you start to, or what is their reaction response when you begin to show them that kind of everything they thought they knew is not exactly true?
It's it's a balance, right? You can't just completely tell somebody right in the beginning, hey, stop doing that. That's not right. You have to ease into the conversation. I think being an athlete myself because I have so much experience as an athlete for years, makes the conversation easier with a lot of other athletes because they see that I was also there. But my biggest thing is sports are not health. That's it. Being a high level athlete is not necessarily healthy. It's that you're a high level athlete and you're training your body to do something that is beyond what humans are supposed to do. Health is being able to walk 15 to 20,000 steps a day, being able to eat really nutritious food. athletes can't always do those things because they're training for a very sport specific thing. So I think understanding that if you're an athlete, doesn't necessarily automatically make you healthy. Sure, it might make you have a six-pack. That doesn't mean you're healthy.
Yeah.
Definitely, actually, with more I know about BRI, having a six-pack doesn't mean you're healthy. So so it's a balance of giving out the information and meeting somebody really where they're at. If somebody's like not interested, and I notice that, and I have that sensation of them and I feel it in my session, I'm not going to keep giving them info. So I think it's tricky because that's all dependent on who the provider is. I am a very intuitive person and I really feed off other people's energies, good and bad. It could be somebody really struggling in pain in front of me and I'm going to go home and think about that, or somebody who can't sense and is very rigid in their thinking. I'm going to feel that, and so I have to really meet the person where they're at. So that's how the conversation has to be. It's a thoughtful conversation.
I love when you said that having a six-pack really is not a sign of health. So I'm what do they call me? An abuelita millennial, right? Like I'm a really old millennial. So I grew up when I was in high school and college when America's Next Top Model was like the huge thing, and the 90s heroin chic look was like all in, and now I see and I understand and have understood for over a decade that the posture, the image that I have in my mind is like 1999, 2000, girl is wearing like a spaghetti strap shirt and a midriff, right? And they're like walking intentionally with their pelvis tipped forward almost to show like, look, there's nothing there. And I started noticing it, like we're literally inverting how we're holding ourselves for what? To look like we don't exist? Like that was the whole idea. So why does having a six-pack not necessarily relate to how healthy you are?
Well, especially for females, especially coming from my background as a weightlifter, I've done bodybuilding, I've done gymnastics, I've done sports where you have to play with your calories, and anytime that an athlete is that low, females in their caloric intake, I think you're putting your system into a potential place of distress. So sure, people can have a six-pack, but I don't want your rectus abdominis to be that strongest muscle there, because it kind of just flexes you. It doesn't necessarily aid in that much rotation. You need your internal, external obliques to help you with that. So there's a couple things. There's a nutrition component with females. There's the actual component of what the muscle does. And when you're starving yourself to have that six-pack, you're not healthy. You're just doing something for an athletic look. Maybe you're doing it for sport, bodybuilding, etc. People are more naturally fit, and definitely genetics plays a role. So I'm not going to say every single person like that has that problem, but I know that CrossFitters, for example, that participate in postural restoration will have changes to their body, and they will feel better. But there's a reason why these CrossFitters and gymnasts with this posture where they're tipped forward on both sides and they've stretched a lot in their life, they have a lot of pain. And we see a lot of even anxiety in gymnasts and these types of athletes. I was an Olympic weightlifter myself, so I can talk about that, but I pretty much don't know a gymnast or Olympic weightlifter that doesn't have problems later on. And I'm not saying every single person, but that's like a commonality that I've seen. And I think a lot of it goes to the fact that when you're gripping with your abs, when you're forward in your pelvis, that's a sympathetic driven position. So we want to be able to get people more under them, feel their heels grounded, and understand where they are in space. And when you're forward, you're kind of just floating away. So it's going to make some people anxious, but yeah.
So when you say you're in a sympathetic position, we're talking about nervous system, the sympathetic nervous system versus the parasympathetic, right? So fight, flight versus actually calm and grounded.
Exactly.
So I really want to, I love that I'm speaking with you, because I loved having this conversation with Neil too, but there's some intricacies with speaking to another woman that is really cool to talk about. So one of the things that I've been finding how intuitively figuring out how to bring into my life is consistent strength training, but from a PRI perspective, right?
Yeah.
Because I can't deny the research that shows that, especially for women, muscle health and strength training is hugely important as you get older, especially for your brain health. So that was really what like got me back into, I believe, a pretty active lifestyle anyway. So focusing on strength training, I was like, okay, this is the reason why. But I also have met resistance in strength training classes with trainers where I'm like, no, I'm not going to lift both at the same time. I will do one at a time. So can we talk a little bit about like how a PRI approach to strength training, especially as a woman, would look like?
I think that we really have started to only do like this bilateral work in our life, whether it came from athletics, I don't really know, but we need to be just doing more alternating things, whether it's single arm or you're moving through space where you're alternating and you're doing one thing on one side. That's what alternating is. You're doing something on one side and then you're doing the opposite on the other side, and then you're switching and you're moving. And I think that we forget that our gait pattern, which is something that is like we are naturally born to be able to do, most people, not everybody, but we are meant to walk. That is a reciprocal alternating motion, and we need to emulate that in our strength training. And I think that it's kind of fallen off the wagon maybe when strength training got bigger with the Arnold stuff, where it's just for hypertrophy, just getting really big. That's going to limit your ability to do this alternating movement. So for me, strength training is something I've done since I'm really young, so I've learned a lot about different types. But now for health, it looks very different than when I trained for a sport. That's why health and sport are so different. So I think that doing things reciprocally, one arm, one leg, is so important for overall health. And you also don't have to load that heavy. And that's coming from somebody who did load really heavy for a long period of time. And I squatted heavy, and I snatched, and I clean and jerked. You really don't have to load heavy to change the tension within. People that want to increase the weight so much, it's because they don't know how to do anything like body weight. To me, if I put somebody in a 90-90 and they have to lift their hips all the way up to feel their hamstrings, like they don't know how to create an internal pressure to elicit tension. And so it's person specific, of course, but understanding that you don't have to keep going up in weights to still make it hard, I think is something that's really powerful for people. Like, it's not impressive to me when someone's like, yeah, I benched this whatever number. I'm like, okay. There's a lot of things that you could be doing that with a super arched back, and now you're going into that sympathetic extension position. So I think understanding mechanics really plays a really different role when it comes to strength training. And I think it can be really powerful for young athletes. If young athletes learn this at a young age and they can understand that what they're doing in their strength and conditioning programs at school and how they're taught is really not that backed in science, I think you can make some pretty significant changes to the trajectory of one's career.
Yeah, I would imagine so, especially how it would protect you from injury.
Totally.
Like just at a very base level.
Versus getting injured. Like today I saw a patient who was injured in the gym. Why do I have stories like that? Because we're not lifting properly. I have stories like that all the time. Mm-hmm. That's a really common reason why people come to see me. And that tells me that what we're doing in the gym does not emulate what we should be doing in normal daily life. So think of our ancestors. They carried rocks, they walked, they built houses. This is overhead alternating movement in a horizontal direction. There's so many things that you could think of. So it's important to think about what we are really meant to do.
So in that vein of thinking of like what we're meant to do, one of the things that you said on the Conscious Wealth podcast that I was like, oh, well, that's probably a ding, ding, ding. That's probably a reason why. Was the PRI's view of barefoot shoes.
Yeah.
And I had been wearing, and then you said specifically Allbirds, and I was like, oh shit, I've been wearing Allbirds for like 3 years and nothing else, and I was in serious pain. Yeah. And it made sense when you were talking about how, like, in theory, it sounds correct, right? Our ancestors evolved walking barefoot. Of course, we would want to walk barefoot. But then, can you explain a little bit more about the fact that when you're walking on a flat surface, like concrete, like a sidewalk, walking without support, mm-hmm. how is that going against what we think we're doing.
Sure. There are like 3 topics that get my Instagram like really riled up. Barefoot shoes is one of them. And I like to talk about it because not that I like to stimulate that, I'm passionate about it because I wore barefoot shoes for 4 years. And I would be walking in New York City and in London. And I remember I went to Vivo Barefoot in London. I was so pumped about my shoes. And I think it's a learning process and a journey. And I think that wearing those is really important for my journey of discovery. And what you're talking about, it's just the truth. The marketing towards barefoot shoes is a brilliant idea. We should not wear much shoes because we are not meant to. However, there is a really important key factor that the barefoot shoe marketing companies, like the barefoot shoes, they're not thinking about. And it's the fact that we are meant to be barefoot on uneven surfaces because that is how our ancestors were walking when they were, walking in the sand and in the desert and in the leaves and the rocks. Yes, our foot is 100% meant to move and be able to get into all different positions on uneven surfaces. But today, we only really walk on flat surfaces. Modern society has evolved us, and so we need to evolve with it. We're here, there's like tile floor, there's wood floor, there's laminate floor, whatever we're walking on. In New York City, you're walking on maybe cobblestone. Okay, so you have a little bit of uneven, but it's flat. That's not the uneven surface that we're meant to be walking on.
Right.
That's not grass, that's not sand. And so the problem is that the foot and really up the chain, the ability to move through the range of motion of the foot becomes diminished, and then it locks up different pieces of the chain. So that's why I see a lot of like chronic neck tension with people with barefoot shoes and more things, way more things. But as soon as you change somebody's shoes to be in a shoe with a heel counter, an arch support, a flexible midfoot, maybe some wide toe box if somebody needs that can make a significant difference to pain overall, whether it's hip pain, back pain, neck pain. I've seen just changing shoes be so significant for people. I've had people change their shoes and not do any techniques, and they're like, I feel better. It's crazy, especially people who come from a barefoot shoe. So the other thing with barefoot shoes that people don't realize is when you're taking off layers, if you come home and you immediately take your shoes and socks off and you want to be grounded, it's actually because your brain can't ground. It's because you're looking for the ground. Now, if you are able to wear like a Brooks or an ASICs, the ones we recommend, that's going to give you the grounding that you might be missing. And I'm not talking about grounding from the earth, like a frequency grounding. I agree, we need that. I live on the beach, I put my feet in the sand all the time, I get that frequency exchange. But this sort of grounding, it's different. It's about getting your body to be back in its center of mass and not floating up and forward. And that sort of grounding can make a really big difference in someone's posture, of course, but also how somebody feels, how somebody sleeps. It really can change how their nervous system is functioning. So shoes are a really big missing link. And yes, it seems kind of crazy. We're putting on this bulky shoe to get through our daily life, but it also seems kind of crazy. I bet 200 years ago, if they said we were walking on flat ground, they'd also think that is crazy. But we have evolved, and so we have to evolve with it. So I agree, we should be barefoot outside, but I disagree that we should be in a barefoot shoe because it's just not going to work.
Yeah.
So understanding the context is really important there.
I will say, so I got the Brooks, and they did make a difference. And then I had to get the custom orthotics, which made a huge difference.
Some people need that.
And I don't, for like energetic reasons, I don't love wearing shoes inside.
I understand.
And it's not necessarily about the grounding. It's just like I don't want what was outside to be, right?
Totally.
So I have slippers that I put my orthotics in.
Oh my God.
So I take them out of my Brooks and I put them in my slippers. And I know it's not ideal because I don't have something on the heel, like around my heel, but it's better than nothing. And it was the same. I begged Neil. I was like, Neil, I cannot be in sneakers all summer. Like my feet get hot. I can't. I'm okay not doing barefoot, but like give me an option. And he was like, if you really need to, Birkenstock. And I said, great, I can do that. Yeah. So I've been rocking the Birkenstocks while it's warm, but I will be switching back.
I love the Birkenstocks. I also don't think you have to be in shoe jail.
Yeah.
Like, there's no reason that you have to be in that shoe all the time. But if you're in treatment, if you're in pain, if you feel uneven, if you feel off in your body, this is something you can control.
Yeah.
It's a very easy modality to use. So to me, it just makes sense. I personally will wear my sneakers, my Brooks, but like if I need to wear something cute, or if I'm gonna go to a wedding, I'm not wearing these shoes. So you don't have to be in shoe jail. It's just when you're in pain and you're struggling that it's important to give your body the time to get better, and then you can wear what you'd like. So
I appreciate the nuance.
Yeah.
Because I know for myself and a lot of the people who watch the show, we can get stuck in dogma. Even though we're like, no, we're free spirits and we're free thinkers. Sometimes we can still get stuck in dogma.
I mean, I wear flip-flops to the beach. I have Birkenstocks. I don't like to put my Birkenstocks in the sand. I don't want to get them ruined. I wear flip-flops. It's okay. I also feel pretty good. I'm non-pain, so it's fine. So I think it's just really person dependent. But if you're one of my patients, you're coming to me and you're really struggling, I'm going to tell you to be in your sneakers as much as you can. So I agree. I think don't get too, because also that will stress people out.
Totally.
If you're too, I have to do this, it's going to stress you out, and that's defeating the purpose.
So one of the things that I've heard you talk about a few times, just different aspects of what we think of as good posture, right? Specifically the shoulders down and back, and also the stomach, like not necessarily sucking it in, right? Letting it just be. And I was so grateful to hear that, because the only other person that I've ever heard talk like that, people I should say, that I've ever heard talk like that, are my chiropractors and my teacher and the people who've been certified through her in the Reynolds technique. So Carol Reynolds, who started the system, really started by teaching actors and dancers.
Okay.
And so as an actress, you're like, well, stomach's in, like chest out, all of these things. And in learning how to actually be in the body, you realize like, okay, so when I need to tap into this incorrect thing for how it looks on screen or whatever, I can do that. And I know that is not my home. Like that's not where my body wants to live. That's an effect that I'm putting on. So I would love for our audience to hear a little bit more about like, why is it okay to like have this just be? Why is it okay to like not be slouching, but to be on top of your collarbone?
Sure. So I'll start it off by like, pretty much everything that society has taught us about posture and breathing too is incorrect. And that's just unfortunate. There's really no research to show certain things. We teach belly breathing. There's really minimal research to show that does anything. I think I learned last week it's like one paper that actually, and it's like not even proven correct. When it comes to posture is airflow. So your airflow and how you are able to have adequate or suboptimal respiration is going to depict in your static posture. When I'm looking at posture, I'm looking at how well or how not well somebody breathes. So we have to understand that posture is how you breathe, and then we understand that we can actually influence posture by the respiratory system. So that's like the baseline of this conversation. When it comes to like what society taught us that was wrong, this whole sit up and keep your legs together, keep your chest up, shoulders down and back, like what I'm essentially doing right now, this makes it really hard to breathe because your ribs are flaring upwards, because I'm essentially right now I'm extending my spine, my ribs are lifted up, and my head is going, I feel my neck already starting to work. I can feel my SCMs. If I am in that position all the time, 24/7, my breathing patterns are going to show, and I might even start to get a forward head from compensating. I might even start to just have obvious visible rib flare. So it's not that I think slouching is necessarily good for you. I think that we need to move in and out of all different positions. That's like an agreed upon thing. But I do think that there's nothing wrong with slouching. And even though it doesn't always look great, when you actually fully exhale and get all your air out, your ribs come down into internal rotation. You slouch. And then you can better breathe into your chest. Your lungs live all the way up into your chest. So this kind of goes into the belly breathing talk, is like when we learn to only breathe through our bellies, we're literally missing airflow into the top third of our lungs up here, into our chest wall. And if we don't get air into our chest wall, we're gonna see this sort of deal, where we're seeing a lot of internal rotation at the shoulders, we're seeing like this divot into the shoulders, and you'll see it on people. And that's because there's a lack of airflow flow up here. Now, when our ribs also lift upwards, into external rotation, we're gonna have a harder time getting air into our upper back. It's called the posterior mediastinum region, and that area, it's almost like as if it's constantly being pushed forward. Someone's like punching you in the back. That area also houses our lungs. So we're focusing a lot in society about belly breathing, not realizing that when you actually push your belly out, it actually makes you extend more. It pushes your center of mass forward, and then you're not able to breathe into your chest and to your back. And if you don't have breathing up here, you're not actually going to be able to ever get grounded properly. There is this whole thing about breathing into all different directions down in the belly. I don't have a problem with breathing like laterally, but I think it's so much more important to be able to breathe into your chest and breathe into your back, and then fully get your air out and get air back up in here. So when it comes to slouching, this sort of a slouch is usually just a compensatory patterning from the ribs actually being so elevated. And that seems confusing to people because people are like, how am I lifted up? I would look like this. No, you're like this, but then your body has actually compensated by coming forward. So that sort of kyphosis terminology, I think that we are trying to treat this from a visible standpoint, and unfortunately you can't see airflow. We can as PRI providers because we are trained to do so. But when you're just looking at someone's static posture and you're like, oh, you're slouching, sit up more, that's actually going to make it you're putting yourself into a cycle of making it worse. Another thing is posture is not just happening from here up. So you have to really have your hamstrings on board to keep your pelvis underneath you instead of it falling forwards on both sides. And in order to have those hamstrings, you need heel contact. You need your brain to understand those heels, which goes back to the shoe conversation. So it's really an extreme head to toe thing. I mean, we can go into dental and vision because you might have problems because your eyes you don't have good binocular vision, or you have a dysfunction happening, or your prescription is wrong, or you're in, so there's a lot of reasons. Or your teeth, you have a crossbite, you have other reasons as to why your actual static posture might be wrong. But from a basic breathing perspective that the techniques in PRI treat, there's a normal thing that we see is this slouch, and underneath that we're all asymmetrical. But that we'll leave it at that right now.
Well, Neil, we got into the asymmetry
Neil.
with Neil, so this is perfect. I do want to talk a little bit about the integration with teeth and vision. We talked a little bit about it with Neil, but I want to dive into it. Specifically around, and it was truly diving into PRI that made this decision for me where I said, nope, I'm not getting LASIK. Because I had thought about it.
Wow.
And I was like, in my mind, there was always a hesitation. I was like, it's my eyes though. I don't want anybody to mess up my eyes. And then I realized, it's just so simple when you realize that the eyes are the beginning of the nervous system. You want to talk about being in sympathetic mode all the time, you're cutting off the connection point of the external world to your internal world. So I would love to talk about LASIK, and I would love to talk about your opinion on retainers and Invisalign.
These are my best topics.
Beautiful, love it.
These are the topics that get people going wild. So let's talk about the visual system first. So the visual system is extremely important because how your brain interprets your space around you it is coming from your eyes. So if you have one eye, let's say that turns out, or you're in a prescription that's incorrect, that's the feedback your brain is getting. So I work with behavioral optometrists that are very trained in understanding that your perception of your space around you comes from your eyes, and you can make significant changes to people's eyes that change their entire system, their body. So that's why I work with the behavioral optometrist in a very integrated fashion, where I go to the appointments and we're working together to kind of come up with the prescription. I don't do the eye doctor stuff, I do the body stuff. And together we find out what works best for that person. When it comes to LASIK, so there's a couple of things. The basic things about LASIK is that every single person that has LASIK done has dry eyes because they're literally cutting a nerve. Sometimes they're shaving down the cornea, but they cut nerves. And so anyone with LASIK, even if you don't really feel it, what I've learned is that these people have dry eyes. And so that's really unfortunate thing that happens from a surgery. There is a 10 times more likelihood of a retinal detachment. So once you have LASIK, you literally need to go to the eye doctor every year because you're putting yourself at a higher risk. Those are like the health things. I'm not an optometrist, I'm not an eye doctor, so those are things that I feel are so important that really need to be shared, and I feel like I have a platform like this to share it with people. So those are those eye health things. From a body perspective, what we typically see is, we were just talking about the patterning we see with the breath. We also have certain patternings we see with the asymmetry, where we're more reliant on the right side of our body, where our body tends to shift over to the right because we have a diaphragm that's bigger on the right side and it's stronger, as well as 3 lobes of lung on the right side and only 2 on the left. And we have a liver that sits on the right side. So because of our internal asymmetries, as well as our brain asymmetry, the left hemisphere and right hemisphere are extremely asymmetrical, and the left hemisphere controls the right side of our body. And it's just, it really pulls us over to that right side for a variety of reasons. We see different other compensatory movements or positional movements because of those asymmetries. Now, back to LASIK. When you get LASIK done, if you are in a position where your body's over on the right side, your left hip is coming forward, your left rib is flaring out, and your head is centering over your right leg, LASIK might hold you there. Your
like when you're on the table and you're getting the procedure
well,
done.
it's just, if whatever prescription they're putting on you, like whatever is in your glasses right now, that's going to keep you in a position, most likely, in your body, whether it's a great position where you can alternate and move well, or not, where you can't rotate. That the lenses on those are so powerful, which is why I work with optometrists to help with the patient to change those lenses. Those lenses can be so powerful to almost hold people hostage. So if you get overcorrected, let's say you get glasses in 3rd grade and your prescription has gone up, I don't know, for 10 years, and you're like, it stopped going up for the last 5 years, I want to get LASIK. That's a common thing. To me, we're correcting people in a chair, sitting down, bringing our head forward onto the photometer, and that's not how our visual system was meant to be. Our visual system is meant to be used in space, walking, moving through space. So if you're correcting coming forward, you're probably going to get a higher tension and probably a little higher prescription. And people really like that perfect view. And that doesn't necessarily mean that that's going to match well with what the body needs to feel good. So if you then go and get LASIK with that prescription on, we might see that the body is tensioned up and stuck over more on one side with the inability to what we call oscillate. Go to the right side, go to the left side, this alternating movement that happens in every single piece of us, even the cranium bones. And this is where we see LASIK be problematic, is at the neck and the cranium. And so when it comes to LASIK, I'm not a fan, but also because I don't like anything permanent. Anything permanent is probably not a good idea. We're not meant to be doing these things where we're changing our eyes to hold ourselves in that position. Our eye has to have some slight flexibility, and you're taking that ability for the eye to do that away. So I understand why people do it. I get it. I wore glasses for 15 years. I totally get it. So there's absolutely no judgment there. It's just that I see the people that are struggling in pain post LASIK surgery, and I've seen patients who were almost pretty suicidal afterwards because of having a binocular vision dysfunction issue that went missing, and they never tested for it, and then they did LASIK, and then people wake up and they can't see, and they don't know where they are in space. Their whole world was shifted upside down. So I think these are risks that need to be discussed, and I don't think they're discussed. And I'm a body person, and I'm discussing it, and I hope that people hear this, and you know, the fact that you didn't do LASIK, that's something was like in your brain, a gut instinct that told you don't. But sometimes people hear this information, they're like, they message me like, I was just about to do LASIK, I don't want to do it anymore. And it's like, wow, great, like I could make a change to your life. Now, my best friend got LASIK. She's totally fine. So I understand that also sometimes people do it and they are fine and they have no problem. But I'm seeing the people that are struggling. So understand where like that comes from.
Yeah.
Yeah.
So these are PRI approved, by the way. I actually did change these after working with Neil. And I don't know for sure that it was specifically the glasses, but I definitely think they had something to do with it. Mm-hmm. Previously, I would have watery eyes, like quite a bit, especially on the right side. And it's very rare. Like I can't
So
remember
that's
the
like
last
a dry
time.
eye symptom.
Right, and I was also for years wearing contacts, and I was always having dry eyes with them. And finally, I just said, I get like this is stupid. I'm done being uncomfortable for vanity. Like it's done. So I did notice that like less dry eye symptoms. Let's talk a little bit about Invisalign and retainers.
Sure. So again, same thing kind of with this. It's similar. Anything permanent is not ideal.
Even wisdom teeth?
I mean like permanent retainers. Wisdom teeth, I think it's a hard topic with wisdom teeth because we're like evolving to not have space for them, and that's just unfortunate. But we are doing a lot of expansion work in the orthodontal world. So then is it like, should we expand enough to have the space? It's kind of complicated with the wisdom teeth. I do think that sometimes people need to get their wisdom teeth out to actually feel better, and sometimes people don't. So it's so person specific.
Yeah. I remember with me, it was just like, it's time. You need them out. Like I had common. And it was a miserable experience, but that's...
Yeah, and some people really struggle with it and some people don't. But with the permanent retainers, is really the permanent stuff. I've had people come in that have had a permanent retainer for like 40 years in their mouth, and it's like the metal one. So same thing with this. I'll kind of make it in the same way. Permanent retainers are, the metal ones specifically, are about 17 to 18% nickel. A lot of people have nickel allergies and they don't realize. A lot of people are sensitive to nickel, whether it's an allergy or sensitivity. Nickel's not necessarily meant to be in our body. They say that they're titanium or stainless steel. It's 17 to 18% of nickel in there. I've done research on it. So that could be problematic for these people that don't realize that maybe that could be influencing them. You might have a gut problem. You might have a skin allergy, and it could be coming from there. So that's the first thing. The second thing is your teeth are going to shift from a body not being able to find center. Your teeth are just a culprit of what is going on with the body. And I think dentists and orthos, like, they're doing what they know because they study teeth.
Right.
If you keep putting braces on somebody or constantly trying to get their teeth in the right position and their teeth are constantly shifting, like that's a body problem. That needs to be referred out to somebody like me who works with the body to get the body neutral. Because if that body is in a place where they're very extended or more on one side and asymmetrical, we're gonna see those teeth just trying to figure out where the center is. I will see entire mouths like moved over to one side. And that tells me that that person was really struggling with understanding their own center of mass within. So permanent retainers, yes, they're gonna hold your teeth there. Sure, that's what they're there for. They will definitely hold your teeth there. But if your teeth are trying to shift to give you some relief, that's going to also be problematic. Also, your teeth need to also have a little bit of movement and mobility throughout the day. Your cranium bones move, although that's a very controversial topic.
They do move though.
100%. The cranium bones move.
I felt it.
They move, and I understand in old school thought process that wasn't a thing, but they move. And they need to have this movement and this wobble throughout the day, and they need to be able to internally rotate, externally rotate the temporal bones. And if they don't, then we're gonna see where we're kind of stuck per se on one side, and we have all these problems that can occur from it that can create pain, neck tension, back pain, etc. And so understanding that when you bind your teeth together like that, you are stopping your cranial bones from moving a little bit. That could cause problems. So I have, like I've said, I've had patients take out the permanent retainer. Like I've sent them to the dentist, they take it out, and they notice changes in their system. Now, if they're really rigid people, they're probably not going to notice a change. But if they're a flexible, like adaptable person, they're probably going to feel different in their body. Yeah. But anything permanent is just not ideal. And I know this topic gets a lot of like hate because nobody's really talking about it. People just have that permanent retainer in their mouth since they're 17 and they continue on with life. And it's like, you're 40 years old, like you can't even clean in between there.
Yeah.
Or same with the like Invisalign like plastic retainers. When you put a little layer of plastic between your teeth, you're changing the position of that TMJ joint. Now, you might change it for the better and actually make it beneficial for you. You might feel better. That's why dental guards sometimes can really help with that. Or it could be causing more problems. And it's the same thing. You're holding your teeth hostage. The same thing as LASIK. If you're holding your teeth without moving every single night and you're waking up with neck pain in the morning, like I would be interested in those permanent retainers, in the removable retainers. Because if you're holding your teeth in a position every single night, and your body, it's centering your mass over one side, or you're in an extended position, or whatever your postural positioning is, that tells me that the retainer you're sleeping in might actually just be holding your body hostage as well. You're holding your teeth hostage. Why is your body able to move? And when I'm saying movement, I'm not just talking about what I'm doing here, right? I'm talking about a neurological position that your brain keeps your bones, your organs, everything in. It's very slight. You're not necessarily, you'll feel it when you feel better.
Right.
But you don't feel it when you're not feeling great.
Yeah.
It's slight.
It's slight, but it has a cumulative effect over time.
100%.
So since we're on the roll with like the juicy topics, I want to talk about one more. Which is stretching and yoga.
Oh, great.
I know. Everybody's going to come after us now.
It's perfect.
So, again, nuance to the topic, but let's talk about the perspective of PRI with stretching and yoga.
Sure. So, I always preface this by saying I was a gymnast for 15 years. So, I stretched my body since I was 5 years old for years. And then I'm sure I stretched for years afterwards. I was able, I could do all of that stuff, and that was part of my life. And I know what it's like to stretch. And I was not a flexible person, but I was flexible more than the average person. I'm not anymore. I don't stretch ever anymore. And so the PRI perspective, if your body is being held into a position of more stress where you're lifted up, like the hamstrings is really the best example for this. I mean, I can even get a pelvis and show you. But with this, when we're in a position where our ribs are lifted up, our pelvis is tilted forward, we have hamstrings that attach into our sit bones, our ischial tuberosities. So imagine your pelvis is coming forward. Your hamstrings are actually just elongating. So then you're going and you're stretching your hamstrings, which is a very common stretch. And we actually notice that the left side is more forward compared to the right. So we see a more elongated left hamstring. And now you're going and stretching that left hamstring. That's just going to put more tension in your body to keep wanting to stretch. It's a vicious cycle, stretching, because as soon as you're done stretching, you feel better for maybe 20 minutes, and then you go on with your day and you feel tight again. And it's because you're not ever getting to the root of the problem. The root of the problem might be your brain's understanding of your entire internal positioning, your pressure management, your respiratory system, your dental occlusion, your visual system, how your feet hit the ground. But you keep stretching, which gives you some temporary relief and is not really fixing anything. If not, it actually could make things a lot worse, because now if you're stretching your hip all the time, like that couch stretch, right? You're actually just pulling on all your ligaments, especially if you have a pelvis that's forward. All those ligaments are being stretched out. And then what happens is when you lose those ligaments, which gymnasts all have lost, you get low back pain, you get the inability to ground, you get anxiety, you get discomfort, because there's no ability to feel grounded because you've literally stretched yourself away. And those muscles are just going to tighten right back up. You can stretch people all day and they're just going to get tight. The best example is if you ever witness surgery, right before surgery, like in a pre-op, before ACL surgery, let's say, they can move that leg when that person is under in every which direction. But as soon as the brain turns on, it tensions up. It's not going to let you do that to someone's leg. You're never going to be able to bring that leg all the way up here unless you do years of stretching training. So you're desensitizing all your body's ability to feel tension and tone, which we need. We don't want too much tension and tone, but we don't want none. And when I see really stretched out hamstrings, I know that person is they can't sense properly.
So what is... They're gonna come at me for this one. So when we talk about yoga, right, and we're talking about breathing and stretching all in one, and movement, how do you approach the conversation where people are like, well, this is the only way that I feel centered. This is the way that I can feel spiritual connection in my body. How do you start to say yes and?
Sure. That's a great question. The meditative aspect of yoga is actually what people are looking for. It's not necessarily always a stretch. And the heat, if they're doing it in the heat, right? That meditative component, you could still go to a yoga class and not butcher your body by stretching. You can still go, and I tell people, I'm like, you can go, if you were going 5 times a week to yoga, I'm like, try to go twice a week and try to replace it with my techniques. Try to do what I want you to do, or be in a good shoe all the time. So it's again, like meeting somebody where they're at. I can't, even if you see like a gymnast, like if I see a gymnast, I'm not gonna tell them to stop stretching. That's part of their sport. They have to do that. So it's about giving people things to do throughout the day that are gonna almost counteract that. I treat a yogi as if they're a gymnast or a contortionist. I've worked with contortionists. They're very hard to work with because they're always putting their body in such contorted positions. Same with yogis. And those three, gymnasts, yogis, contortionists, probably have the most pain. Yogis and contortionists worse than gymnasts. But I think that it's meeting the person where they're at. Are they willing to give up a few days of their yoga class? Are they willing to try to do PRI techniques for, if they need a longer period of time, do 40 minutes of it. I don't usually ever recommend that, but I use them like 20 minutes, that's good. But if you feel like you need to do techniques for a certain amount of time to negate your yoga, missing a yoga class, then fine. Whatever works for that person works for me. So I always want to meet the person where they're at, and I don't want to scare them away from their sport, mainly because I had to stop my sport like in cold turkey, and it was horrible, and it was so horrible. And so I would never ever tell somebody like stop doing something that you love, because also something about yoga, if somebody really loves yoga, then it's going to also de-stress them, and that's also what I'm going for.
Right.
So what somebody loves is really important to me, whether it's music, sports, whatever. I think it's an important component that can be put into their healing.
Yeah. So one last piece on the stretching. If someone is doing strength training but not going crazy, like doing individual sides, is stretching important before or after strength training?
I would do before like a little dynamic warm-up where you're moving through space. I have no problem with a dynamic stretch. That's great. Cool. But there's no evidence to show, like none, that there's actually evidence against static stretching.
Yeah.
That holding positions for a long period of time usually lowers the power output. I saw that, there was a research paper on it.
So when you say stretching while moving, right? So would something like a roll down?
Yeah, or like crawls, you know, different crawling movements, like a cross connect type movement. I'll do like a world's greatest stretch. We're just moving, getting people warm.
Just getting the blood flowing more than anything.
Yeah, like some track warm-ups are really good. Like there's like certain different track warm-ups that you could do to get moving and warm, and those are wonderful for before training, for a whole workout.
I could talk to you like all night, but I just want to wrap up with one thing specific to me. Yeah. I love your take on it, right? I ask everybody who's like does any sort of body work this question. Okay. Because I'm really curious. So I am shocked that I have had my feet on the ground, like basically flat on the ground this whole time, because normally this is torture for me. Like normally my feet are like this.
Interesting.
Right? Where like I'm crossed like this, but having them just like this is like usually torture for me. So the fact that I could even do this the entire time we were talking, like while we were talking, I'm thinking, wow, this is crazy.
That's groundedness though.
So is that really what it has been in my past, where like the way Neil puts it is I don't trust my left side to find the ground, right? So I'm so hesitant that the ground will be there that like I don't even want to put my heels down. Is that?
It could be. It could be that your brain just doesn't trust it, that you're not used to. I mean, look, I'm short, so like for me to actually put my feet on the ground, it's really hard because my knees have to go lower than my hips. You're not really in that boat, so it could be that I do see like people always twitching and moving, like that's a nervous system that can't chill. So it also could be that your nervous system is getting into that parasympathetic and you are comfortable with your heels on the ground and feeling your ground underneath your feet. So I agree with Neil.
I'm getting better.
It's awesome.
It is awesome. It really is awesome.
It's empowering.
It is. It's funny, I haven't actually had a session with him in a few months. We need to get back together. But even just these seemingly minor tweaks have such a huge effect. And then, okay, so that was the last thing. I have one more question. How do you feel, how do you incorporate myofascial release? What do you think about that from a PRI perspective?
I think that it can be powerful. I think, though, that the nervous system is the king and the brain is the king. So you can release muscles and the person can feel better, for sure. If somebody's in pain, no problem with it. Do I think it will come back? Yeah, most likely. And I think that understanding that there's a nervous system component where your body is maybe being pulled or torqued or twisted, and a respiratory component, if you leave those two out, I think that could be difficult to actually get your patient better. But I tell people all the time, like, I think soft tissue work is really powerful. It just has to be followed up with things.
Yeah.
So.
That makes sense.
Yeah.
Cool.
Yeah.
Well, I would love to have you on again, because
Sure.
this is amazing. And I also wanted to shout you out. So you have your online course happening soon, is that right?
Yeah. So I have something called Rooted Well, and I'm just putting out 2 courses. They're almost ready. There's going to be Rooted Well Foundations and Rooted Well Advanced. So Foundations is going to talk about a lot of what we talked about today with breathing, and there's interviews, and there's really like techniques to help people with what they're struggling with. So anybody who listens to this who's interested and doesn't know where to start or doesn't have a provider near them, that you're going to get the techniques you need to get yourself into a better position. And then for Rooted Well Advanced, that's more about the dental, the vision, those components, myofunctional therapy, how I work with all these people. Same thing, interviews, techniques that focus on this, and there are 2 separate courses. One technically leads into the other. I would want people to start with the foundations to then move to the advanced, but I do want to make it accessible for people to also be at home and get better from their home. So that's the point.
So exciting.
Yeah, thank you. It should be released like within 2 weeks. So.
Oh, so by the time this airs, you're going to be able to get the courses.
So
Amazing. So we'll link them in the show notes so that people can.
Thank you so
get
much.
Them. Absolutely, I'm so excited for this.
Thank you.
And thank you so much for doing this interview. I've been looking forward to this for a long time.
I'm so glad, and it was so cool in person. It was
awesome. It was so much better than online. I think.
Yeah, I agree. Thank
Awesome.
you so much for having me.
Thank you. Queridas, we made it to one of my favorite parts of each episode, the moment of flow. I love poetry. I love words and rhythm, and how when you mix the two, you get into a beautiful state of flow. And so I want to leave you with that at the end of each episode. So here it is, your moment of flow. The lines of my life. Left, meet right. A photo of myself, folded in half, reveals 2 different people, both calling themselves me. Studying the picture, I see the stories rooted in one side, not the other. The horror of childhood trauma etched on the left, the courage to heal sitting determinedly on the right. The lines of my life, revealing their stories. My left eye shows the memory of a late-night car ride, pushing myself through the sunroof, wind and moonlight mirroring the excitement in between my thighs. Flip the picture, and the right eye takes me to right now, recognizing the path to future memories and stories to come. Which is me? Yes, and.